In this session of East Minute, we will be looking at the APPAC trial, evaluating antibiotic therapy versus appendectomy for treatment of uncomplicated acute appendicitis. Appendectomy continues to be the standard of care for acute appendicitis. However, with the improvement in the quality of the CT scans and the diagnosis of acute appendicitis, antibiotics have been used recently for treatment of acute appendicitis with reported low mortality. There has been multiple randomized controlled trials that evaluate this specific question with variable reported results and limitations. The purpose of this trial is to test the hypothesis that acute appendicitis can be treated successfully with antibiotics. The trial was conducted at 6 different hospitals in Finland. Inclusion criteria is any patient with suspected appendicitis that is confirmed on CAT scan. If patients had CT findings of appendiculite, perforation, abscess or tumor, or they were younger than 18 and could not consent, or signs of peritonitis, were excluded from this randomization. The patients were randomized to the surgical appendectomy arm, which included laparoscopic or open depending on the surgeon's preference, or to the antibiotic arm, which used ertapenem for 3 days, followed by oral levofloxacin and flagyl for 7 days. The follow-up was at 0, 1, or 2 days during the patient's hospitalization, and at 1 week, 2 months, and 1 year after discharge. Outcomes measured for the antibiotic group included the resolution of appendicitis or development of recurrent appendicitis. For the surgical group, the outcome that measured by the authors included successful completion of appendectomy. The authors also evaluated secondary endpoints, which included late recurrence of appendicitis in the antibiotic group, length of stay or length of hospitalization, amount of sick leave and pain score reported by patients, use of pain medications, and surgical complications such as wound infection or incisional hernias. A total of 530 patients were randomized in the trial. 272 were included in the primary analysis for appendectomy, and 256 were included in the primary analysis for the antibiotic group. Overall, the patient populations were similar in demographics. In terms of the results, in the appendectomy group, 99.6% had a successful appendectomy. Of these appendectomy, only 5% were performed laparoscopic. The overall complication rate was 20.5%, and that included wound infections and incisional hernias. In the antibiotic group, 27.3% needed appendectomy at 1 year, with 72.7% not requiring any surgical intervention at 1 year. Of the patients treated with antibiotics, 5.8% required appendectomy during that hospitalization. And the authors report that the overall complication rate for patients who required appendectomy after being treated with antibiotic was 7%. How can we apply this data in clinical practice? The authors conclude that antibiotic treatment for acute appendicitis did not meet non-inferiority criteria compared to appendectomy. They also recognize the limitations of the studies, which are 1. Small sample size underpowering the study itself, 2. The fact that the appendectomies performed are open, 95% reported, and 3. The short follow-up period at 1 year. This last point has been addressed by the authors in the follow-up study, which looked at the recurrence rate at 5 years. The late recurrence rate at 5 years has been reported at 39.1%.